So without further delay, I'd like to introduce Corey Feist and Jennifer Feist, co-founders of the Lorna Breen Heroes Foundation, who are here with us today. They're going to be giving the opening keynote address. So Corey Feist is a healthcare executive with over 20 years experience. He's the co-founder of the Dr. Lorna Breen Heroes Foundation and currently serves as the Chief Executive Officer of the University of Virginia Physician Group, which is a medical group practice of the UVA health system that has over 1,200 physicians, as well as advanced practice professionals. Feist holds adjunct faculty appointment at UVA Darden School of Business, where he recently taught a course about how to manage in the pandemic. Certainly has been a challenging situation for all of us. He's also chair of the board of the Charlottesville Free Clinic. And Jennifer Feist is joining us as well today from Charlottesville, Virginia. She is an attorney and specializes in finance, real estate, and wealth management. She's also co-founder of the Dr. Lorna Breen Heroes Foundation and sister of Dr. Lorna Breen. She serves as a treasurer for the Central Virginia chapter of Girls on the Run and is also the co-founder of Women's United, which is a nonprofit dedicating to supporting causes that benefit women and children. So just as another plug for Twitter, when we were doing some work to change the Minnesota Licensure Board question around physician health, I tweeted about it. And as a result of that, both Corey and Jennifer came to the Minnesota Board of Medical Practice virtual meeting and really advocated on our behalf, on all of our behalf, to get the question changed. And in a large part, due to them sharing their story, we were able to successfully change the Minnesota Board of Medical Practice question around physician health, and that'll take into effect in January. So thank you for coming to that, and thank you for coming today. So without further delay, I'd like to welcome the Feist to the stage.
Hi, everybody. Thank you for having us, and thank you for that introduction. I was happy to attend that meeting. I feel like I'm always on a soapbox, and I'll probably always be on a soapbox, but I am thrilled to hear that outcome, and I'd like to hear that it happens in every single state in this country, so thank you. I'm Jennifer Feist, also known as Jennifer Breen Feist. I'm Lorna's sister. And my husband, Corey, is going to come up here very soon. I won't take much time, and update all of you on all of the wonderful and incredible progress we have made in the last year and a half since my sister passed away and since we created our foundation. I will assume, Corey said I shouldn't assume this, but I'm going to assume many of you know about my sister, Lorna. She was a doctor in New York. And in 2020, she died by suicide. But I want to take a moment to back up and tell you about my sister, Lorna Breen, before she was the namesake for our foundation and before she was the namesake for our federal legislation. That's my sister there with me, my other sister, Karen, and our mom, and my sister's husband and their kids, the day that Lorna graduated from medical school in 1999. Like many people who chose to practice medicine, this was a goal my sister set for herself very early on. She worked hard, she hustled. And I have to laugh because I think there's a look that doctors have. It's very earnest, it's usually very smart. And I was out there getting my coffee and I saw a lot of people that looked just like my sister. She hustled and she did what she had to do to become a doctor, as I know all of you have as well. This is me and my sister on New Year's Eve in Miami, and she was fun. She was funny. We had a great time together, always. We were always together. The third person in this picture, who you can't see, is Corey, my husband. He was taking the picture. The three of us were always together, and then when Corey and I had kids, it was always the five of us. Lorna had an intense job. She was the director of the Allen at New York Presbyterian Health System. That's one of their emergency departments, faculty at Columbia Medical School. It was an intense job, but she loved it, and it was exactly what she had always wanted to do, where she had always wanted to do it. Lorna lived in Manhattan. There was always a party, a group of friends to meet up with, always a trip to take. And she was with us for every holiday, every family milestone, every spring break. I took a picture out of this presentation. Corey said you shouldn't show that one. It's a picture of me and Lorna like 30 minutes after our son was born. And I do not look good. But I'm eating a cheeseburger, and my sister's standing next to me with a huge smile on her face. This is us, also doing something fun, wine tasting on my dad's 80th birthday. I don't think my sister was any less driven or any less of a perfectionist than anybody in this room or anybody with a medical degree. She didn't have anxiety, she didn't have depression, she didn't have mental health challenges, she didn't have addiction, she didn't have debt. She didn't have habits that you might think would lead somebody to end their life the way my sister did. So this is a picture of my sister with Corey and our daughter Charlotte in Big Sky, Montana. Lorna always went on spring break with us and our kids. This picture was taken during the last week that I consider the world to have been normal. It was in early March of 2020. The night this picture was taken, my sister and I sat in the hot tub for a long time. And we made plans for her 50th birthday, which would have been October of 2020. 1 week later, 1 week after this picture was taken, my sister was immersed in her role in the emergency department at New York Presbyterian. This is when about a week before she tested positive for COVID. 3 weeks after this picture was taken, my sister went back to work, probably still sick with COVID. She was working 18-hour days, sleeping in the hall like all her colleagues. 24 days later, she died by suicide. So I know that we are not the first people to lose a loved one, and we're not the first people to deal with loss or grief. But when my sister died, we were all looking at each other saying, why? Why did this happen? How did this happen? We were in the news all over the world. Corey and I did an interview with Nippon Television in Japan. We were everywhere. And then something happened that I found to be completely unbelievable. People started calling us and emailing us and writing us letters. People were leaving notes in our mailbox. A lady 2 houses up from us brought us some flowers and told me about her uncle, who was a physician who died by suicide. Everybody started telling us their own stories, and we were like, what is happening here? Families of doctors, families of nurses, calling to tell us their tragic stories about suicide. Total strangers telling us, like pouring their hearts out to us. And we quickly learned that the suicide rate of physicians is twice that of the normal population in the United States, which you all probably know. 400 doctors die every year by suicide. Early on, we learned a phrase that I had never heard before. It's a term coined by a physician in Virginia, the parallel pandemic, which refers to the mental health crisis in medicine, as well as the constantly rising burnout rates. What is this? Why is this a thing? Why does this exist? I was shocked. It is unacceptable. When my sister got sick, she kept telling me she was going to lose her license and she was going to lose her job because she had required psychiatric care. She was mortified. She said that even if those things didn't happen, her colleagues would never want to work with her again. And I promised her she was wrong. After she died, we found out she was right. Corey and I met a doctor from the Boston area. His wife was also a physician. They lost a child to a rare medical disease, and the wife, for obvious reasons, needed to talk to somebody, but she was concerned about her license. So she sought therapy in another town under a fake name. She paid for antidepressants in cash. She died by suicide. We met a woman in Utah. Her husband was an ER doctor, like my sister, inundated by COVID patients early on, overwhelmed. He needed help, and he needed somebody to talk to, but he didn't want to say anything because he didn't want to compromise his career. Incredible. Ultimately, he was hospitalized, but his insurance would only pay for him to get psychiatric care in the hospital where he worked. So he was on the psych floor in the hospital where he worked, being cared for by his own colleagues. Shortly after he was discharged, he died by suicide. We heard from a physician in Kentucky who told us, when it comes to mental health, our healthcare system is still literally in the dark ages when it comes to ignoring and fostering physician stress. We have a daughter about to embark on her residency, and I fear for her future unless significant reform can be brought about to end the stigma of mental health on physicians. This is not okay. This is not normal. It's not acceptable, it's not right, and it must end. I believe my sister died because she was a physician. And despite the fact that my father was a trauma surgeon, my mother was a nurse, my brother's a radiologist, and my own husband has worked in healthcare for 20 years, I had no idea how close we were to disaster until after it struck. So here we are. I'm not a doctor. I have nothing to do with healthcare. But I'm here with my husband. Corey and I have started a journey to change this paradigm for others who are still practicing medicine every day, still doing the right thing, still giving everything you have to care for total strangers. We have a big, hairy, audacious goal, but we've already made great strides like what we just heard about this morning, and we are just getting started. So with that, I'd like to introduce you to my husband, Corey Feist.
She said I'm not allowed to cry, so we're good. All good. She's pretty impressive, isn't she? Remarkable. So, wow, it's great to drop water on television. It's great to see you all in 3D. Many of you this last year I've met in 2D. I can't tell who you are still because you don't have faces on, but I want to assure you, just in keeping with our Zoom theme, I'm not wearing socks because it's still just, I can't do it. It's too much, sorry. I tried it one day in the Capitol and it was too hot. So it is really a pleasure to be here with you, and just remind me next time that I get invited to one of these to not follow her, because I don't know how I'm going to do justice to this. I do remember when we were contacted by Dr. Sinsky a year plus ago and invited us to this conference. The first, we were so disoriented still from the trauma that we had gone through that I thought it was that like 2020, didn't have the date right, so I miscalendared it. But that's not why I point that out. I point it out because I remember being invited to speak thinking I have no idea what we're gonna say. I have no idea what we're gonna do, but I do know that we are in this arena and we are gonna try to make a difference. And so I hope that when I get invited and I fly out to Phoenix, because there won't be COVID at that point, obviously, it'll all be gone, that I have something positive to report. Bear with me a little bit here. This in some ways will be our first annual report to our board of directors. So it's really a pleasure to be here. and to share this journey with you, and know that, as Jennifer said, we're just getting started. So I know that this is an academic conference of sorts, and you are scientists, so I love to think about this as Brene Brown said, maybe stories are just data with soul. So bear with us as we try to put some data to this story, because I do believe that this story and the work that we've done and all the stories that we've heard really put soul to the work that many of you do, many of you study, and many of you are here in this arena with us today to try to fix. I'm going to go to a little bit of our story as told by Savannah Guthrie. So if you've seen this, bear with me. If you have not, this was us on the Today Show for the 1-year anniversary of Lorna's death.
We're back as Carson joins us with a tough but very important story that impacts a lot of frontline workers.
Yeah, this pandemic has taken so many lives, but the early loss of a doctor right here in New York City has served as both a warning sign and a rallying point as well.
Yeah, you may remember 1 year ago this week, Dr. Lorna Breen, an emergency room physician, died by suicide. Her sister and brother-in-law opened up to us on the show just days afterwards. And from that moment forward, Jennifer and Corey Feist have been on a mission, laser focused on trying to make a difference in caring for healthcare professionals, tackling the mental health taboos in the medical community. It's been just over a year since the unthinkable happened.
She was my right arm and my left arm. I used to call her my twin, my sister, my other spouse. We were attached at the hip forever, so it's been a real challenge.
A challenge that Jennifer and Corey Feist are meeting by making it their mission to help other healthcare workers, creating the Dr. Lorna Breen Heroes Foundation, and working with their Senator Tim Kaine on legislation that aims to reduce and prevent suicide and burnout among healthcare professionals.
Let's pass this bill and show that we care about our healers and are committed to providing them the resources and the culture they need to keep healing.
It took a lot of courage in those first days of just stunned grief for you to speak out. What has driven you all this time and since those early days?
Savannah, I believe that this could have been avoided. That's what's driven me. And if we can help somebody else in the healthcare profession avoid an outcome like my sister had, this will have all been worth it.
Jennifer's 49-year-old sister Lorna died by suicide last April after first fighting the flood of COVID-19 patients coming into her New York City emergency room.
The volume of death and dying that they experienced was something that they'd never seen in their career.
And then battling the virus herself. The more you learn about Lorna, the more unfathomable this is. What have you come to believe or understand about what led to her passing?
What I know today is the same thing I knew even before my sister died, which was that she got sick with COVID and it affected her brain. The tragedy is she had enough of her faculties to know that if she raised her hand as a physician and said, I can't think, I can't work, I need help, it could have been devastating to her career. We know now exactly the same thing I knew a year ago, which is that it was the combination of COVID and the culture in medicine that killed my sister.
While more than 8 in 10 emergency room physicians like Dr. Breen reported feeling more stress since the pandemic, nearly half polled said they did not feel comfortable seeking mental health treatment, with over 70% saying there's a stigma in the workplace surrounding getting help. It seems like in our culture we talk about mental health all the time and that the stigma has really faded away. But in medicine, that stigma is still there.
Mm-hmm. It's there and it's strong. It is a well-established premise in healthcare that you do not seek mental health care. You just don't. We've heard.
And why? Why?
It's because of the licensing. It's because of the credentialing, and also it's because of your potential harm to your reputation as somebody who can't take it. You know, I will tell you, Savannah, one of the real struggles with my sister was that she thought she was going to lose her license. And what we learned after she died is that New York State has some of the best licensing laws in the United States. And so my question is, why didn't she know that?
Doctors are licensed by the state they practice in, and in some states, the applications ask probing questions about whether they've been treated for mental illness. At times, experts say in violation of the American with Disabilities Act.
Only one state, and that is the state of Mississippi, has the best possible questions. It literally says, we recognize there's a connection there between your taking care of yourself and your quality of care. We want you to attest to us that you're doing that and you're taking care of yourself. We need 49 more of those to happen across the country.
The Feists and their foundation are working to eliminate any barrier to seeking help, just as healthcare workers across the country begin to come to grips with what they've experienced in the past year, a year when they've been more than just doctors and nurses.
We're also asking them to, say the rosary with a dying patient, which is a story I heard from somebody who couldn't be with her father when he was dying. And there was a nurse who said the rosary with him every day. So we're blurring these lines.
Are you worried that we're on the verge of a new crisis, a mental health crisis for healthcare workers?
Oh, there's no doubt in my mind. And there's significant data to back that up. In the heat of trauma, people are just focused on getting through it. It's when things calm down. It's when you relax. It's when you can take a breath. That's when the real problems start. And so, yes, we are so thankful for the vaccines, and we are thrilled. The fact of the matter is these people have been in the battle for a year now, and now is the time that we really need to focus on the people who have been taking care of us for the last year.
I look at you two. I think about meeting you a year ago in the depths of your grief, and I look now at what you have already accomplished. What do you think Lorna would have thought of her baby sister and how hard you've worked on her behalf?
I think she would love it. I think my sister was here for a reason, and maybe this is it. We have made changes, Savannah. We've heard from people who have changed the way they live because they heard what happened to my sister, and I think she would love it.
So it became really hard for us to tell that story over and over and over again based on who wanted to tell every appearance that we'd made. So I appreciate those bearing with us with someone else telling kind of the story. It was remarkable to me how focused Savannah was, she's also an attorney, if you're not aware, on this licensure issue and the other issues. And I really appreciated her highlighting this story in a way that was more about the issue as opposed to just sensationalizing a suicide. Since that piece aired, I've spoken to a number of journalists across the world about how to report on these issues, and I often point to this focus on the issue rather than sensationalizing a suicide as one of the best practices. So as Jennifer said, when we went first out into the public, and let me just point out something among friends into a little circle here for those who aren't aware. We had no intention to publish Lorna's cause of death. In fact, it was published against our expressed desires and wishes 12 hours after she died. One of the hardest calls that I ever got was from one of Lorna's colleagues who worked at a major New York, had a prior career at a major New York newspaper. And my phone was blowing up right after Lorna died, and I answered this one, and she said, "I'm really sorry to introduce myself under these circumstances, but you need to know that this is being published." And so I got on the phone with the editor of that paper, and I begged him. I literally was on my knees. I just said, "Please don't do this. Please don't do this." And he said, "We already did 6 minutes ago, and we don't take it down." So I remember having that conversation, and our son, who was I guess 16 at the time, had found it already on the internet and beat me to tell Jennifer the news that it was out. And at that moment, and in the subsequent hours that followed, we made a choice, which was that we needed to tell the story in our words, having been kind of forced into this limelight. So as Jennifer said, we heard from hundreds, if not thousands of people after Dr. Breen died, sharing their stories, some of which Jennifer quoted from today. Others were basically sharing with us examples of how they had gone on sabbatical at a period of time or gone and done a fellowship during their training, but if you really drilled into it, they had a breakdown. They had something gone wrong. They were human and had to cover it up literally on their CVs to avoid stigma, to avoid professional repercussions. And so because, let's be clear, Jennifer's a better lawyer than I am, she got us tax-exempt status in 29 days. The federal government's never moved that fast, ever, I promise you. But we filed to be a tax-exempt nonprofit in June of 2020. With the focus of really dedicating our kind of foundation to reducing burnout and safeguarding the well-being of the workforce. And it's interesting now, looking back on those words that we chose at the time, how little we actually knew about the subject. I hadn't met Dr. Sinsky yet and hadn't spent hours with her educating myself on this topic. But really with this aspirational goal of envisioning a world where seeking mental health services is universally viewed as a sign of strength. And it's kind of that simple. But we all know that to this onion that is the healthcare industry and the workforce, that it is not simple. But some of it is. So I'm going to share with you a little bit about what we've been doing. So there have now been over 300 articles in the national media telling this story in some way. Jennifer and I have co-authored 11 national publications, including one on physician suicide, but most are on the issue, a broader sense. It was actually an academic piece published by Academic Medicine, which is the AAMC's publication, with some noted suicidologists. Didn't even know that specialty existed, by the way, until this all came up. We've done this all on Zoom 60 plus times. This is our first in person, so let me know how we're doing. Thank you. Wow. Thanks. I'll be here all week to try the veal. I'm actually going back to a different meeting to add 61 to this in person this weekend. We've done tons of podcasts. We have a social media following now, and Lorna appeared at the Democratic National Convention on one of the ads. So we have one DNC appearance in our reach, and so I know you all are data folks. So how do we quantify that? Well, first, before I do that, I want to share with you another area of our outreach that we've just launched right before this last National Physician Suicide Awareness Day. With our partners, they're here, Physician Foundation. They're one of the lead sponsors of this event. But together with the Physician Foundation, a year ago, Dr. Gary Price and I did a satellite media tour in the industry. And here's a new acronym for you in healthcare. That's SMT, probably one you don't have, a satellite media tour where you sit with an earbud for 5 hours and answer the same question over and over again in 30-second clips and don't ever see anybody on the other side. It was tough, but we did it, and in that day we reached 50 million people, Dr. Price and I, through the Physician Foundation. And this year we wanted to highlight and do something even more enriching. So we developed this website, npsaday.org, together with the Physician Foundation and our friends at First Responders First. I'll talk a little bit about First Responders First in a little bit. But this tool that we've launched is an evolution of the tools that had been previously put out by the founders of National Physician Suicide Awareness Day. And it has tools not just for the individuals, but also for organizations. And don't worry, Jennifer and I didn't curate the tools ourselves. We had professionals do that. But it immediately was met with very positive feedback. And again, we're trying to raise awareness and produce content out there that will be meaningful. And so this is the number that I was thinking was one slide above. We've reached over 100 million people. Thank you. And while that number is incredible, what's behind it are some of the most powerful words I've ever received by anyone at any time. So I'm going to share with you not just our impact in numbers, but again, remember, stories are data with soul. So here's a little story. This is a physician who wrote me on the eve of Thanksgiving. Today, I want to say how thankful I am that the Dr. Lorna Breen Heroes Foundation exists. Lorna's death was what pushed me to get help, the details of which I still don't talk about because I fear it will be held against me. Every time I see a picture of her, I see myself, I see my residents, I see my colleagues. So after we received that, Jennifer had told me when we started this, if we can just help one person, it will have all been worth it. I said, so I think we got our one. Are we done? And as she said in her closing, we're just getting started. Here's our impact as received by me about 5 nights ago from a clinician, a mental health professional taking care of a physician. If you ever wondered about the immediate impact of the work you are doing or whether it's necessary to share Lorna's story and the specific conversations you had with her, please know that it saved this client's life. And she'd excerpt a text message which said, "My reputation is ruined. My career is over." She is safe now because I was able to recognize the similarities in what Lorna told you. Thank you. I don't know how many of those we have not received, how many people this story, reaching over 100 million people, has actually impacted. This is some of the soul behind the data that I wanted to share and the impact and the importance of talking about this. While this is a really complicated issue, folks, and lots of layers to this onion, one of the things that we can do every single day is just talk about it. The more we talk about it, the more people we can impact in a positive way. So as you saw in that clip from the Today Show, there's also federal legislation bearing Lorna's name. And many of you, I know Dr. John Ripp, I don't know where you are, John, but you're out there somewhere, I hope, because we're having drinks. Oh, there you are, way in the back. Good to see you, John. John told me that we're having drinks tonight, so anybody wants to join us, we can. John is one of the other partners that we've had, and haven't met him in 3D yet, so it'll be fun. But we spent a day on Capitol Hill recently that you can see the picture with Senator Kaine. But John told me, he said, I spent the whole summer working on this HRSA grant. My team spent this summer working on this HRSA grant. Are you responsible for that? I said, heck yeah, I am. The Lorna Breen Act unanimously passed the Senate in August. It is with the House Energy and Commerce Committee. It has over 120 co-sponsors right now. It has over 80 endorsements from healthcare organizations like the AMA, like the Physician Foundation. And it has over $140 million in new programmatic funding, which made its way into HRSA grants already, which is why many of you may have spent the summer applying for grants, and that comes from the dollars that are in the Lorna Breen Act. So we still want the act to pass because we hope that it will be the foundation for more policy in the future, but the money is literally being allocated in the next 30 to 60 days to institutions. And we know it won't go far enough based on how many people asked me for letters of endorsement for their applications this summer. We know it won't go far enough because there just isn't enough money. So we need the partnership of every health system in the country to make this happen. And so if anyone wants to come out of this meeting with a little action item, the House Energy and Commerce Committee needs a little push to hold a hearing so that this bill can be taken up. The way that legislation works is it gets assigned to a committee, and if the committee doesn't hold a hearing on it and do what's called a markup, which is fancy for vote, it doesn't move. And so we need the House Energy and Commerce to move. And so if you happen to be from a state, and you can look up the House Energy and Commerce Committee on the web, if you happen to be from a state that has a member, write them a letter, send them a note, send them a tweet. Tell your friends, we need them to act on the Lorna Breen Act. In addition to our work at a federal level, we have been really focusing on the local and state level as well, and removing barriers and ensuring consistent support. That's it, right? Consistent support. So recently we just published in U.S. News and World Report an opinion piece because in our travels over the last 18 months, what we've learned are there are at least 6 known barriers, some of whom Jennifer has talked about already. 6 known barriers for physicians in particular. Malpractice insurance, legal discovery in malpractice cases. Did you know that if you're sued in a malpractice case in many states, they will actually ask for your mental health medical record? Who knew that? I'm a lawyer in healthcare. I had no idea. So Virginia has a law called the Safe Haven Law, which protects your mental health medical record if you're sued in a malpractice suit. But there are many states that don't, like as in most. Medical plan design, as Jennifer said, the physician in Utah who was forced to use his own healthcare facility. State licensure, as we've talked about ad nauseum, hospital credentialing, and then the credentialing process for commercial insurance to be on the insurance panels. Now, I'll tell you a little story here, because one of the things that on that npsaday.org website that we asked, one thing hospitals can do right now for their physicians is to publish what the facts versus myths are about these 6 for your own people. This is some of the simple stuff that can and should be done and has to be done. For the Feist family, this is personal. Dr. Breen was misinformed about the state of her license in New York State. But for so many, this is lore. Not only do physicians not understand it, but as you know, sometimes you switch jobs. You move to another state. In one state, New York, you would have been fine getting mental health treatment. But go to Alaska, no chance. So we need to publish for our own employees, our own physicians, our own nurses, because some of this stuff also applies to nurses. The rules, just tell them what the facts are. I'll tell you a quick story. I don't think anyone else is here from the University of Virginia, although you may be on Zoom. Hi, back home. We looked at our bylaws, our credentialing questions at UVA 3 weeks ago for the first time. We changed them within 48 hours. It was simple. We had a credentialing committee meeting on a Friday. We looked at it. We literally saw it on a Wednesday. We fast-tracked it. We changed it. And then we told everyone we did. Some of this stuff is basic. Some of it's communication. It all has to be done, and we need your help doing it. This was one that blew me away. The New York Academy of Medicine is honoring our work in policy later in November. They see and understand that this is an issue as well. And there needs to be more of us who are getting acknowledged for this policy work in the healthcare space right now. We were truly blown away by that phone call. Little Feist family sitting in Charlottesville, Virginia behind our desks, trying to blow it up for everybody. Last week I was in Time Magazine. I don't remember doing the interview with Time Magazine. Apparently I said this, or they made it up. It made me sound smart. The media tends to do that. We need real solutions that work for people like Lorna. She was the canary in the coal mine for us and for many people. We don't need to make our canaries stronger. We need to redesign the coal mine. And that is exactly what you all are doing here in this conference. You're helping to redesign the coal mine. I know we started with meditation, and I love meditation, but we don't need more meditation apps for doctors. They don't need that. What they need is a redesigned workplace. Earlier this week, I was in our first ever meeting between health system leadership and the university leadership at the University of Virginia. There were 25 of us, and we talked about what our priorities were for the university president. And he went around the room, and he asked each one of us what our priorities were. I introduced him to the concept of pajama time. I said, this isn't what you did with your kids. This is what doctors do every day. Of the 25 people in the room who went around briefing President Ryan on all of the significant initiatives, I was the only one who he asked a follow-up question and said, we need to do that now at scale and fix this problem. Here's the way we're focusing on fixing this problem. So from awareness to action and education. So finally, I'm going to talk a little bit about this education, and I'm going to walk you through a few slides because I'm inviting every single one of you to the party. It's called All In, after all. I learned when you call something all in, it's hard to exclude people. This is all about the quadruple aim. So I told you earlier that I would tell you a little bit about First Responders First and who they are. First Responders First is a consortium of 4 organizations, which you'll see on the right of your screen. Thrive Global Corporation, which is Arianna Huffington's business-to-business mental health company. The Harvard T.H. Chan School of Public Health. The Creative Artist Agency Foundation. For those who don't know, that acronym CAA is the world's largest talent agency. And Johnson & Johnson. And together with our foundation, we have launched All In Wellbeing First for Healthcare, because we recognize that in order to achieve the patient-focused goals and aspirations of healthcare, the first thing we have to do is take care of our own. We have a steering committee, including many of you in this room today. Our collaborators, the AMA, the AHA, nurses associations, our friends at CHARM, National Black Nurses Association, the Schwartz Center for Compassionate Care, the American Association of Colleges of Nursing. We just added the American College of Emergency Medicine yesterday, and a couple others. We're growing this initiative, and here's our focus. This is a call to action to transform a cultural shift that accelerates progress and promotes meaningful action and accountability in our healthcare workforce. We have 2 primary aims. The first is to advance a state where the well-being of the workforce is prioritized and individual healthcare workers feel valued and supported so they can sustain their sense of purpose and meaning in their work. Our friends at the AMA told us how important the concept of feeling valued and supported is when 50% of the healthcare workforce only feels slightly valued or doesn't feel valued at all by their employer right now. And the feeling of value ties to your own individual resilience and susceptibility to burnout. Makes intuitive sense, right? If I'm feeling better about my job, maybe I'm more susceptible, or maybe I'm more tolerant of the administrative processes that get in between doctors and their patients. Also known as the BS, right? The BS of your day. But you're more tolerant. Focusing on this question of feeling valued is a very individual one. What makes me feel valued is different, and it's different within business units, within a hospital, inpatient unit, outpatient units, but these are the conversations that need to happen. And we also want to make beneficial progress against the persistent mental health and well-being challenges that disadvantage healthcare workers, parentheses, doctors in particular, end parentheses, and therefore the healthcare systems. We know that if the workforce is stressed, is burnt out, has PTSD, that is going to impact patient care. Again, kind of a no-brainer, but we needed data to support it, and we have data on burnout, at least, that does support the impact on quality. We are achieving our aims through convenings of experts and breaking down silos. You'll see those 2 circles overlap in the top left. One of the things I've done my entire career in healthcare is get people in the same room and say, you're working on something, you didn't know it, get in the room and talk about it. When we talk at our bi-weekly meetings of our steering committee, this committee here, it never ceases to amaze me that when they share across, they didn't know that the other organization was working on this. Every other week this happens in real time. This is what we need to do at scale. We want to accelerate this cultural shift, amplify and recognize role models. We know that they're out there. We need to tell the story. We also have money. Wait, did he just say they have money? He said they have money. So we're pointing out that there's a problem. We're bringing solutions and cash to the party. Who's not all in now, right? We have $1 million. It's not the Lorna Breen Act. But because of our big sponsors with Johnson & Johnson, as well as the money that the Feist received through the outpouring of support after Dr. Lorna Breen died, which we've contributed to this fund, as well as other organizations who are contributing to this fund. We are providing financial resources through a grant program for the members of our All In campaign. We want to share data. You all love data. We love data. It needs to be shared at scale on these issues. And we need to do a little advocacy, not lobbying, but we need to do a little advocacy to share at all levels, whether it's us beaming into virtual Minnesota Licensing Board meetings, or whether we go and just spend the weekend with Senator Kaine and his colleagues, which is what Jennifer and I are about to fly back to the East Coast to do this weekend. We're doing the same talk for his colleagues because this is one of his top priorities, and he wants to have an update from us. It's not as nice a resort. It is not as nice a resort. But we're doing it because he's amazing. Here's how we structured ourselves. We have Tier 1 collaborators who are our steering committee, who are really leading this effort. You've seen the logos. We also are creating what we're calling a resilience marketplace or library. Now, this isn't resilience as in make the workforce more resilient. This is a make the healthcare institutions more resilient. So we know that there are at least 2 buckets of Tier 2 collaborators right now that are self-identifying. One are organizations, you may be in some, who want to share your best practices with others, because this is not something that we are over-resourced on. We need to share. So there are many organizations who are raising their hands and saying, I want to share what we've done here, whether it's EMR optimization or whether it's team-based care or whether it's peer support programs, whatever they are, these folks are stepping in and they're sharing. As well, as you might imagine, there are some vendors who also have some products that might be helpful. We're not endorsing anyone's products, but we're putting it all together in a library of sorts for those who join us. And then finally to our members, which is basically any physician organization, any nurses organization, any hospital. And we've asked them to make a commitment of 4 things. And we feel like those 4 things are actually the action that needs to happen right now everywhere. Number 1, commit to the well-being of the workforce. Tell your workforce that you see them and you hear them and you are here for them. Number 2, recognize that organizations play a significant role in not only creating this problem, but also solving it. Number 3, pick a goal, any goal, just 1, maybe 2. Make it a priority. Make the goal something that relates to well-being this year, tell everybody about it, and then use the free tools we're going to give you to move the needle. We're not trying to boil the ocean here, we are trying to be a catalyst for change. And I believe that it is important for us to start small in some places, but in some places you're much further along, but many places are lagging the curve. Okay. For those organizations who come in and are members, again, it costs absolutely no dollars to be members. We're providing a ton of curated resources, a full interactive community. We will have convenings and webinars, and then those organizations will be eligible to apply for grants. And that grant pool is growing from the initial $1 million. So far, we have 200 plus individuals and organizations who have joined us. We've created this fund. We are about to launch our library of resources. In Virginia, Jennifer and I gave a talk last spring about the intersection between this issue and quality. And so the Virginia Hospital Association, the Virginia Nursing Association, and the Medical Society of Virginia were on that call, and they said, we want to step into this arena too. And so they created an initiative called Caring for Virginia Caregivers, and they're using our model and our infrastructure with their membership. We have all the hospitals and health systems in Virginia participating in this initiative, and some of them don't even know they're participating in our initiative. But that's okay, we don't care. We're not looking for, this isn't about ego, this is about fixing this problem. Right now, our website is is about to transition to our new interactive community. You can find out more about it at allinforhealthcare.org. Right now, it redirects you to the Lorna Breen Foundation website. But for those who are interested, stay tuned, because in the next 2 weeks, we're going to be launching this brand new interactive community, which has been curated by our steering committee. Because we're related also in working with a creative artists agency, it's amazing what happens in the public eye. For those who are not aware, there's a new documentary that is coming out called The First Wave. The First Wave is a documentary that was recorded in real time at the Long Island Jewish Hospital, Northwells Hospital, the hospital where Dr. Breen did her training. When they found out about us, when they found out about this initiative, as they start to promote this movie, they said, we want to see how we can make an immediate impact as well. So they're helping us first pass the Lorna Breen Act. We're going to have a private viewing of this movie with members of Congress in about 3 weeks at the National Gallery of Art, just down the street from the United States Capitol. And we're inviting members of the Energy and Commerce Committee. And then later in November, we will be at the premiere of the movie in New York. And all of the marketing associated with the premiere of the movie, and as well as many of the proceeds, will go to fund this fund and help promote the All In Fund. I tried to figure out how to drop the video in here, but I'm not that good of a tech guy. But it's hard to watch. For those of you who went through it, I'm sure it would be hard to watch. But it's important to tell this story. I'll end by saying thank you. Jennifer and I are in this arena. We are in this arena as partners with each one of you. We hope you feel that partnership. We hope that our first of hopefully many annual reports to you all is one that that's well received. But we want you to know that even though this topic is a complicated one, you're taking many hours and days out of your important lives to work on it. Some of this is so simple. Some of this is leadership taking accountability, sharing and modeling behaviors. There's our physicians, senior physicians showing junior physicians what it's like to take care of themselves before their patients. Some of this is just talking, creating a dialogue. Some of this is just checking in on each other, tapping each other on the shoulder and saying, how are you really today? So thank you so much for the opportunity to be here. I know I'm probably a little under, but I'm also happy to take any questions if anyone has any. Thank you for having us on behalf of the Dr. Lorna Breen Heroes Foundation, on behalf of Jennifer and me. Hopefully we'll see you soon. Thank you. My first standing ovation. Hold on. I'll take pictures of you. Thank you. Someone else in charge now? Okay. Question in the back? Questions? Comments? Are we doing questions?
Hello?
Has any of the national organizations like the Academy of Family Medicine or Internal Medicine or so on contacted you, or have you been in contact with them? Has there been any reciprocity on what you folks are doing and what the attitude of the academies are?
Many of those academies have endorsed the Lorna Breen Act, but we have, other than the foundations or the organizations who are on our steering committee for the All In campaign, we have not been in touch with them directly. Give them my number. Yeah.
I just wanted to thank you for being here and all that you've accomplished. in the last year and a half. You mentioned all the great work you've done with state licensing boards, credentialing work, advocating with Congress. On one of the slides, you had a logo, U.S. News and World Report. Any progress with rating agencies and how they sort of look at the importance of physician well-being when they come out with their ratings for health systems?
I love that question. Thank you. In July a year ago, Jennifer and I co-authored our first call to action in the public sphere with U.S. News and World Report, and it was on National Best Hospitals in America Day. And I told them that I would publish and write a piece for them if I could call on them to include the well-being of their workforce in their rating. Here's what they told me. Write whatever you want, absolutely, and we'll talk to you about it. And I've talked to them about it. And you all maybe can help me with this. U.S. News and World Report relies on publicly reported data for its metrics, and they didn't know of any publicly available data that they could simply extract from to do this reporting. I have a direct line with the person at U.S. News and World Report who's responsible for all this, and so if anyone knows a tool that we can direct them to, they were very willing to have this conversation. So thank you for the question.
Hi, Corey, thank you. I'm Lauren Pecorello from Mount Sinai. Nice to meet you in person.
Hi, nice to see you in person.
So one of the things I've been thinking about a lot is this idea of having a passion for what you do, being protective in well-being, and I know we talk about that always as a group. But I also wonder, on the flip side, as physicians who feel like this work is our calling, and we might not be able to do anything else, if something comes along that threatens that, it becomes our downfall. So I wonder what you've thought about that, and if you've, in listening to people who've experienced this, have heard anything like that.
Yeah, I think it's really a critically important point here, and it's certainly something that, Dr. Breen, this is why I said stories are data with soul. I mean, Lorna was in her MBA program. She was trying to advance her career and in a way redefine herself. As I teach at the business school at the University of Virginia, I have tons of physicians who are in that same boat, who are trying to evolve their career. Many of them are bailing out of medicine because it's tough, right? But yeah, that's, I was speaking with a therapist who did a lot of post 9/11 first responder work. And what she said was the rise in suicide among first responders post 9/11 is a lot of it had to do with you take the tools away from the person, and they so self-identify with those tools. So you take the gun out of the way of the police officer, you take the hose away from the fire, you take your stethoscopes away and your white coats away. You have so much of your identity that is there. I guess what I would say to all of that is you all are more than that fabric. It's a big part of you, but it's not all of you. I have also seen physicians who have struggled with significant issues, substance abuse, other issues, who have gone through the process of redefining themselves and come out better, faster, better, stronger, $1 Million Man or whatever that thing was, right? So that it is possible, but I know that in that moment, for many, it looks like it is an insurmountable mountain to climb, and it is one, certainly, that is what you've done your whole life. You all have to decide on your careers really so early. Middle school, probably some of you have always wanted to be doctors. I don't know anybody who decided on this after college, really. I mean, it's a life calling. So, oh, you did? All right, great. After college. Did you just start, sir? I see you have a hairline like mine. Yeah. Peace Corps volunteer. Okay, but look at how many other people didn't raise their hand to that, right? So I mean, I can't wait to meet you. Yes, sir.
Well, I really respect the work you're doing, which
Thank
I think is fantastic. I am curious, as a former emergency physician, did your sister and sister-in-law ever ask the lawyers in the family about one of the root causes of driving a perfectionist to be a hyper-perfectionist, and that is the fear of malpractice that exists today in medicine. It's become endemic.
Yeah.
When I entered the field, malpractice was kind of, yeah, something that if you really screwed up happened. Now it's an ever-present, almost a violent fear that drives physicians, especially emergency physicians, to question their every move, leading to the stress that we need to alleviate by what you're doing.
Yeah, it's an excellent point. It's not really something that Lorna spoke to us a lot about. In my world at the University of Virginia, I speak to doctors about it a lot. And it is certainly a significant, an adverse event, whatever that might be, an adverse outcome, let alone a lawsuit, are known triggers for issues. And one of the things that I think we need to do a better job of in healthcare is when we know what that list of triggers is, we need to immediately create interventions for our physicians to understand it. In the military, as an example, every single soldier comes back from a military exercise, they have to have a debriefing with a mental health professional. So it is certainly something that structurally can be baked into the design. But I know it's a significant stressor, and I wish that, as a lawyer, I could make it all go away, to be honest with you. I've always been on the right side of this thing, and I know that it is a significant issue for many. And just walking around with that fear and that lingering over your head is a big deal. And so, like I said earlier, this is a complex onion here that we've got to get to, but I appreciate the question very much.
Thank you.